Hey guys, welcome to my channel Green Drive Mate. Here I have come with another important video. Last time we have talked about the revision strategy for the upcoming NEETPG 2025. Then I have got many more messages in my Instagram. So I thought, and I promised to you also that in the next video I will be talk about some of the important topics, mainly the previous year topics. Better to talk about the previous year topics that have come repeatedly in the subsequent PG entrance examinations. We'll do with all the 19 subjects. Today with this video we'll start with the first year subject, that is anatomy. I have listed down some important topics from which how many questions have came. I have listed the number, so with that information you can see in the background only, of course. So we can get an advantage and idea at how many questions can come in this time from this app, from this respected topic. So we can give an particular time to these topics of this subject, so that we do not give extra time or less time to any subject. Whatever it demands we can give, and we'll go to the next subject. Okay, so without wasting any time, let's come to the topic. Okay, yeah, let's start. Listen, in anatomy, physiology and biochemistry. Anatomy, here we got embryology, 27 questions, very important topic. Histology, 13 questions. Today this is from 2018 to 2024. Okay, neuroanatomy, head neck 14, neuroanatomy 35, upper limb 25, thorax 20, lower limb 10, abdomen pelvis 15, general anatomy 6 questions. General anatomy is very much less important, so mainly important in neuroanatomy. We can expect one question, head neck one question, upper limb one, lower limb one, thorax maybe or may not be, embryology 2 questions important. So on an average 6 to 8 questions, max to max 10 questions. 10 questions hardly comes, so we can expect 6 questions. Okay, fine. We will discuss physio and biochemistry in the subsequent videos. Today I have not written about the each general cardio, neuro. I need to write some more detailed topics with this to previous PYT topics. These are only the chapters. I will write in the PYT topics, and then again we will come with the next video. Okay, so we'll give a detailed explanation of each subject, so we can get an overview of that subject. Okay, don't be in a hurry. Yeah, I'm writing, so in this process. Yeah, let's come to the anatomy PYTs of each and every year that has been focused in the NEET coming in the NEETPG examination. So we can get an overview that what topics must need to be studied or need to be kept in the 20th notebook, or keep to be in the in our vision that we need to revise this before going to the exam. Okay, so let's start. Aphasia, very important topic. Aphasia topics can be integrated with the medicine, neuroanatomy, and with the neuromedicine. Okay, CVS embryology, I think that's not very much important topic. Yeah, Broadman area is very much important, especially important in the INICET. NEET it hardly comes, but may comes. Yeah, here I want to say that one more important thing, especially in these subjects like anatomy, physiology, biochemistry, I have noticed that you must practice questions from FMG previous year, as because in 2024 NEET also you will get to see one important topic. Which question? Yeah, this posterior tibial artery. This question was a extremely repeated question in FMG. I have practiced this question in FMG previous year questions. All year I have practiced that question. There I got to this question 2 times. One is 2016-17, and one is 2021, like this. Okay, I have practiced that. So during the exam hall, when I have got this question, I was just literally happy. And the same question, the question was like, they have just given a picture of that foot, and they have showed that palpitation process. Okay, there they are saying that you will get the pulse of which artery. There the question answer was posterior tibial artery. This is exact the same to same questions was repeated 2 to 3 times in FMG. Not a single time it was repeated in NEETPG. Yeah, we know already that both NEETPG and FMG has the same board conducting exam, so they can give FMG questions to NEETPG ones, to NEETPG questions to FMG ones. Okay, because in this current during this code sessions, we are going out of the topic just for a little bit. During this code session, some people brought a case against this, then why NB people not disclosing the questions and the disclosing the answers. They have given their views that if we disclose the questions, we will be short out of questions. We will not get proper questions to give in the exam. We'll get low number of questions. Means question will be out of. So they so we can at least we can have a thinking process to what they are thinking to give a new question. They have this same topic, they don't have much more wider than this. Okay, so either they can do these questions of FMG questions to NEETPG or NEETPG questions to FMG. Now in this 2025 this Jan FMG, I have seen many questions from NEETPG directly to FMG. In fact, the FMG people need to do all the questions from a NEETPG. INICET I'm not telling to do, that is totally a different scenario. But yeah, NEETPG FMG people have to do the 10 years questions before going for FMG from the NEETPG, especially in this non-clinical and paraclinical subjects. Here you have limited number of the questions, we have to either copy paste from different scenario or we have some simple modification, so the answer remains same but the question scenario a little bit changes, that's all. Yeah, so let's come to the topic. We are going to the 2018 PYT topics. Okay, then again the question was we have discussed broadband area. Yeah, cranial nerve nuclei. Cranial nerve nuclei is very important. Which cranial nerve nuclei important? Second nerve, 2, 5 trigeminal, 7, 9, 10. Wait, I'm showing you 7th, 5, again 7, 9th, 5, 9th. You got to know why it is very important to learn number 2, 5, 7, 9, 10. These 5 nerves you have to read by heart. Its course, its associated ganglion related to it, and its supply, and everything, if it's injured, and everything. If you want to detailed explanation of this 2, 5, 7, 9, 10, you can DM me in my Instagram. I will thought and I will give a new video to talk about only these 5 nerves, because one question from this nerve will have to come. You know why 4th nerve is important? It's important only because of its course and nothing else. As because and its function, you know, all solar, ALL, SO, LR, 3, 4, 6 and nothing else. 4 for superior oblique. 4th as because it go backward and then it come forward. Only because of its course the 4th nerve is important. Rest 2, 5, 7, 9, 10. Keep it in mind. Okay, go, let's go. First strip is muscle attached, something is important. Frontanels, yeah, it's important. You know why? Because of its closure. Any topic in the non-clinical subject is important only because of its relevance to the non-clinical subject. Fontanelles is very important as because we palpate that anterior frontal is the last one to close, I think. Then again, pelvic anatomy, very important. Its diameter, it's mainly related to Ausgyne. We will study there. We'll discuss in the later. It's only because of as is because talking about the anatomy part. So I have kept it here. We can study it from the gynae part. Okay, and mainly obstetrics part. Pharyngeal arches, and there is very important. Pharyngeal arches, we can't afford to give an exam without studying the pharyngeal arches. Venous arch, aortic arches, mainly these two, and all that pharyngeal plexus, pharyngeal arches is very important. Cleft, then the lip, everything is important. Skull anatomy, mainly the skull foramina, all the foramens and whatever it passes through it is very important. We have to read this. Fourth nerve I have already discussed about. Types of joint, we need to study the types of joint, because mainly in the INICET exam they have to give one question based, they have to give in INICET May 23 2023 they have given two questions based on this joint. In November 2023 also they have given one question from the joint. So types of joint mainly from the INICET point of view, yeah, NEET also can give, as because they have given in the 2018. Okay, 2019 decoherent tenosynovitis, we'll discuss about this topic in ortho, no problem. Corpus callosum, sometimes it may give, I think is mainly the IBQ question to pointer object. Dermatomes and root values, very important topic from both orthopedics and anatomy point of view, integrated topic. and then heart blood supply, I'm coming later about this. Heart blood supply, both artery and venous, very important, keep it in mind. They will give IBQ question from this. They will draw one venous and they will mark pointer and they will keep on question mark, then and will ask what is that, what is this, or which supply or which part, or one more question, they will give one venous and they will give and ask about the which is the parallel artery that supplies to this part, from which the venous drainage is conveyed by this vein, or vice versa also. Artery can you give, then ask about the vein. Heart blood supply, internal capsule, very important, is blood supply, internal capsule diagram, genu, and what are the ganglions from from anterior part, genu part, and the posterior part, which is supply, retro part, and the sub part also. Liver anatomy, you have to read all that 8 for some. Lower limb nerve supply is very important, very important. We can't, every year they give a lower limb nerve and they ask about the injury, fibula fracture, tibia fracture, ankle fracture, anything they can give and ask about the nerve injury. Wait, I'm showing why it is important. Lower limb, but we'll combine nerve injuries, upper limb and lower limb together. Nerve injuries, lower limb. Nerve injuries, upper limb. Nerve injuries, lower limb. 2021, 2022. Wait. Nerve injuries, upper limb. Nerve injuries, lower limb. 2023. They are given posterior artery. They are fed up with the lower limb nerves. Yeah, obturator nerve. They are not fed up at all. This obturator nerve, up to how much I remember these questions, the nerve will supply both the hip and the knee joint. They were asked about like this. Okay, median nerve means upper limb nerve. I have already shown you upper limb nerve. Its injuries at various points. What are the muscle itself in the hand? What is the function? Median nerve, you have to read everything, both from the orthopedic point of view, which factor leads to the median nerve disruption, and from the median nerve anatomical point of view, median nerve supply, median nerve to the muscle, median nerve to the hand muscles, its course, everything. Muscles of forearm is not too much very important. Maybe they can give an IVQ. This is not too much important on the muscles of the forearm. Yeah, whatever the nerve supply, that the radial nerve, median nerve, and ulnar nerve, its course through the muscles of the forearm, that muscles is very important. If you want to know that only particular muscles, if you want to read only few muscles of the forearm, read those muscles which are involved in suggesting the process or supply of radial nerve, median nerve, and ulnar nerve. Okay, only read those muscles, course of that nerve. I'm forgetting about the term. Yeah. Muscle of hand, very important. All hypothenar, thenar, lumbricals, dab, you know already. Everything muscles of hand is function. You could not miss interossei. You cannot miss any of the single muscle. Its nerve supply, its function. Very simple. And its attachment to maybe they may be given exam, they may give an image of IBQ and lumbricals attachment, and they can ask which muscle is this. Based on its attachment, you have to identify those, because we know pad and dab as because mm, the some muscles are attached, especially the intraocular muscles are very difficult to identify. They can ask only those topics, because in some of the fingers they are attached, in some of the fingers they are not attached, in some of the fingers they are double attached. So read it carefully from that topic. Omphalocele gastroscopy difference and identification, also bladder exostrophy is that is the same question repeating every year. Pharyngeal arch derivatives, again and again I told you, is already very important. Radial nerve, upper lumbar nerve injury, I told you. Fifth canal, I told you. Types of joint, again types of joint, very important. And vertebral column anatomy is not so much important. Maybe they can give one vertebral column bones and they can ask what about this, what about this. So rarely it comes, but sometimes it have came. Yeah, okay, fine. 2019. Again come to the anal carcinoma topic. We will take it as integrated with surgery point of view. Mainly is very important for the surgery point of view, as because you were talking about the anatomy, so I have kept it here. Okay, anatomical subnox is very important. You have to read both its boundaries, its contents, and its position. Biceps brachii muscle, CVS embryology, I told you, it came already 2018 again. So read this once again. Cell cycle and division, easy. Cerebellar disorder, yeah, it's very important. Like patient forgetting his balance, dysdiatroponesia, they can ask someone, they can integrate with the medicine. Okay, and which point of the point of the cerebellum is mainly affected? Mainly the cerebellum 3 lobes that is coming in the neuroanatomy. That cerebellum part in the neuroanatomy you have to study by heart. Mainly the 3 lobes and its particular function is very easy. And that in the histology part, the Purkinje cells and that 4 DEFG, you are getting dentate emboliform fasciculus and yeah, and the nerve fibers, mossy fibers, which nerve fibers is carrying which yeah, which information, and which is exiting, which is entry, that one. And Purkinje I told, and what are left, yeah, which one is the positive and which one is the negative. I just discussed about all the easy important topics of the cerebellum here only. Just read this like this, so that everything just comes in your mind, just thinking about the word cerebellum. Okay, cerebellar tracts is very easy. You just think about the, keep in mind about the middle and the superior, rest all are in the inferior part. You will get in every notes. If you want to teach about this topic, you can DM me, so I can think about keeping a video on this topic, or a short video in Instagram reels. You can follow my Instagram channel, prep at once. Okay, I will give the description in the, I will give the link in the description. Okay, cerebellum, lobes and nuclei, I told already about it. Seventh cranial nerve I told, Bell's palsy I told already. Fallopian tube, we'll talk about this in the gynae part. Fetal circulation is very important, as because it's very important in the pediatrics and the CVS disorder. So in that point of view, the fetal circulation in the anatomy is very important. Okay, nothing I told on already, the topics which are important and have the good clinical relevance in the clinical subject is very important in the non-clinical part. Ischemic stroke, localization of stroke and CNS lesion will get correlated with this topic. With the neuromedicine topic is nothing but all that CNS and the localization, that all the syndromes, all that syndromes they can ask about this topic. Both it is covered in both anatomy and neuromedicine. You have to study one time, so that is covered in get both. Okay, don't read this by each, and from anatomy one, from medicine one, read at a time from both. Okay, all that syndromes, lateral medullary syndrome, middle medullary syndrome, Wallenbach syndrome, and what are there? Yeah, a few are there, I'm forgetting. So like this, all the topic. Muscle of hand, we have already discussed. Pancreas anatomy, beta cell, islet cells, pancreas carcinoma, surgical point of view. Pharyngeal arch derivative, again, a proper anatomical important point of view. Spaces and fossa of the upper limb, yeah, very important. Spaces and fossa of the upper limb, you have to read this. It's because important, any infection in this fossa, what is the treatment. So because of the infection, we need to it's a good clinical element, so we have to read the anatomical spaces. Stomach anatomy, especially about the lymph nodes, especially about the gastric cancers. So we need to read about the stomach anatomy, and it's mainly about the blood supply. Blood supply is very, very important. Stomach anatomy, it has come lot of times. Stroke, brain stem syndromes, I already discussed about. Thyroid gland anatomy, it's capsule, thyroid false capsule, true capsule, is a supply, upper supply, lower supply, isthmus part. Read the thyroid gland anatomy very delightfully, because it's important both in the surgical point of view, because of the lymph node cancer spread, any the ELN nerve, RLN nerve is mainly important in the ENT point of view. What happens if during the surgery this nerve gets cut, that nerve gets cut? So what are the clinical features and a person's face? What are the emergency measures during that emergency? Because of this clinical point of view, we have to read much about the thyroid gland anatomy part. Okay. Types of cartilage and types of joint. Types of cartilage mainly from the histology point of view, and types of joint already I have discussed about. We have come in the 2021 and 2022. Okay, mesentery, especially the small intestine mesentery, greater omentum, lesser omentum, mainly that epiploic foramen boundaries, appendicular mesenterum. These are the important clinical topics. So we can expect that and from anatomical point of view, they can give only this type of questions which have a good clinical relevance. I think these only are the few. Sigmoid colon, yeah, this is also good clinical relevance. Appendix, sigmoid colon, small intestine, greater omentum, lesser omentum, and this mesentery. I think this is good important. Circle of Willis, arachnoid hemorrhage. They can give an image, and they can give and to identify this artery also, or its supply, or its course, or its branch, anything related to circle of Willis, they can give question. We have discussed all about these three, so nothing to think about. Salivary gland anatomy, yeah, we can think. And tongue gland anatomy, tongue gland anatomy mainly I'm asking from the histology point of view. All the four papilla, you have to read this histological structure, and you have to identify mainly those questions come, and types of cartilage, same from the histological point of view mainly. And what they can give an histology, and they can ask in the given option, this type of cartilage is found in the which of the body. This easy part, you can just remember of the type of cartilage and whatever the structure found, whatever the cartilage found in which structures. 2023, 2024. Inguinal canal anatomy from the surgical point of view, very, very important. Cover, anatomical, anterior, posterior, down, opening, contents, proper content, improper content. These are the inguinal canal. The triangles, medial triangle, Heisenberg triangle. These are all, I think, the inguinal canal in anatomical part. I talk about the lower limb, muscles of mastication, very, very important topic. In AIMS, in INICET, in FMGE, in every exam they give the four muscles, mainly the lateral pterygoid muscle. I don't know why they have so much affection with the lateral pterygoid muscle. They give a lot of questions like that to identify either its function, either it's the only muscle, or is to just IBQ. The four muscles, very important, just its course, its action, its picture, and its muscles and muscle function. Just keep it in mind, nothing else. If you want to read one thing and from the anatomy, I will tell these are the muscles: mastication, pharyngeal, and the 2, 5, 7, 9, 10. At least 3 to 4 questions that you can solve easily. Parotid abscess, PDA, patent rectus arteriosus from the pediatrics point of view, pharyngeal arches derivatives I already discussed about. Umbilical artery is reminence, mainly is important from the pediatrics point of view is reminence. Urogenital tract is very important. Yeah, one more topic is important is paramesonephric duct and mesonephric duct. I have discussed about this. I think why I'm not getting mesonephric duct and paramesonephric duct is very important, and urogenital is very mesonephric and paranephric duct, and the urogenital tract also. This formation, these two difference between paranephric and mesonephric, what are the structure derived from the mesonephric and the paranephric and the urogenital tract. These last two structures, the things you have to read by heart before going to the exam from the anatomical point of view. Okay, from the embryological point of view. From embryological, these few topics are very important. That's why the reason they have given embryology 27 questions in 2028 to 24. Brachial plexus is very important. Read all the nerves, mainly the radial nerve, ulnar nerve, median nerve. These three very important. And RTDC, root trunk division cords. read the diagram by heart. They can ask which division this is, they can give an arrow and the question mark and ask which division this and what are the nerves derived from this division. Okay, they can give this with IBQ related question. And I'm see with discussing the topics, I am telling you the questions also, what questions they can give with such topics also, and what are the uh, nerves coming out from the other roots, trunks, and everything. That also you have to read. And from brachial plexus, what more else question they can give? Root value they won't ask, just they can ask from which chord this is, from which it is from root or it is from trunk. One from trunk to there no nerve supply comes. Sorry, from division, from trunk it comes. What left? Yeah, like this only from brachial plexus these questions can come. Omphalocele gastrocnemius we have already discussed. The skull foramen I've already told about. Tongue anatomy I've already told about. Medial pectoral nerve, yeah, is mainly from the breast anatomy point, mainly from the surgical point of view, because lateral pectoral nerve, medial pectoral nerve is both very important, because medial pectoral nerve supplies first, then it goes to the lateral pectoral muscle, and lateral pectoral nerve serve only the medial pectoral muscles, I think so. So because of some important anatomical point of view, they have asked this question. Otherwise, from all, not only they need to ask this medial pectoral nerve, because it has some one clinical importance in the surgical point. Ureter epithelium, transitional epithelium, very important, and tibial posterior and anterior posterior, they can identify some muscles, not such from clinical important point of view. Yeah, these all PYT topics is very important. So you got a brief what are the important topics of anatomy you have to study before the exam. Okay, I hope you got a good important topics analysis of the anatomy. So now you can have a good grip over the anatomy, what are the topics. Yeah, so let's think about the thing. Today I have to complete anatomy. Today is my second revision. I have already started. Today I have to complete anatomy. What I have discussed in the last previous videos. In the last previous videos, I have discussed about that you need to start it from in the second division RR and the BTR or DVT, whatever, and RR from any particular subject. And here I have talked about all the important topic in the PYTs and what are the important topics that come forward in the next upcoming exams. Okay. So let's correlate these PYT topics in the BTR or DVT and parallel along with correlate this and or highlight this in the RR. So first we read all these. I have given 2 days, one for the neuroanatomy head neck and the rest from the suplex inflex, and in the medium I told much more questions from the abdomen thorax part is not coming, so we can keep it in the evening or in the night just before the sleep. So in the 2 days the whole anatomy is just completed. Okay, so first we read for the head neck. Let's come with the first head neck. Let's sort out the topic from 2018, 2019, 2021. We have sorted out the topics. We'll see in the BTR and the DVT, and we will see it in the RR. We'll just recapitulate from what are the important topics. We are not forgetting anything. Yeah. Topic, you read all these topics. Done. Head and neck done. Next, go to the neuroanatomy. Okay. Again, same procedure. Let's see the important topics. See in the BTR RR. See in the RR. Read all the topics. Extra information. Keep it aside. Remember it. It didn't have come. Okay, no problem. It can come. Read it or. We have completed, finished. Then next go embryology. Same procedure, done. Okay, after completing everything, once you go to the main notes, see once. If anything you have left or not, just flip your pages. You have seen that you have completed this, you have completed this, you have completed this. Just when you have completed this, if some like in important topic, we are not talking about the scapular anastomosis in the which part? In the supex part. We have not talked about all the important topic in this important topic, but it is very important. It can come. It has came also in the previous before 2016-17 it has came, but in these few years it has not come, but it can come. So I am telling you to refer to the ones to the main notes, because we have already covered the important topics. So we don't need to read further about the important topics. First we have covered the important topics. So whatever out of 15 questions, for example, out of 10 questions coming from the anatomy, we have covered 6 to 7 questions. 3 questions left, approx. 3 questions that come from the main notes. So we will refer to the main notes. we will see that main notes are covering or not, and then again we just flip up the pages. Important topics are flipped out. Anything left that we have not covered, we just have a give a good reading. Yeah, important topics also covered, main notes also covered, revision also done, everything in these 2 days. This is how you need to consolidate important topics, revision topics, and topics which are skipped from the main notes, again ultimately covering that. This is how our subject is completed. Next morning, wake up with a fresh mind, give a SWT, 50 questions, 50 minutes, good, try to good score, score good, and if score bad, don't be sad. It's nothing to be sad. You have worked hard. Of course, is the marks will be good, very good, if you have give a proper good reading in the second revision, and the questions which you have made wrong, please analysis why it is made wrong. If it is not from the topic you have studied, then study that, because it is giving in SWT, you will get a good extra one, some extra knowledge. Maybe it's important, maybe it's not important, no problem, we'll give a good extra knowledge. We will keep it in mind, because our ultimate target is to keep crack NEETPG 2025 15 June. Okay, so nothing to be said. Get good marks, get good questions, study hard. Best of luck. We'll meet with the next video on the topic physiology PYTs. Okay, hope you like this video. Subscribe to my channel. Don't forget to like and subscribe. Stay tuned, and if you are want to important some more topics, you can write in the comment section, or you can DM me in my Instagram, prep at once. I will give that link in the description. So I think you like this video. Bye bye, take care.